Welcome. I'm Jan Marini, the founder of Jan Marini Skin Research. I am here today with Audrey, and we're going to be doing her consultation. Audrey is the manager of a waxing center, hair waxing. So Audrey, I'm going to ask you a few questions. If there was something you could change or improve about your skin, what would it be?
The scars, definitely, that I have around my cheek areas.
When you say acne scars?
Mm-hmm.
And let me just ask you, is this discoloration, or do you actually have a loss of tissue? Do you have like indentations?
I do have indentations, yeah.
Okay.
I also think it's coloring too, because I do, maybe once or twice a week, I'll go tanning in the beds. And so I know that towards my face, it'll change the color of my skin too. So it kind of brings out my acne scars more.
Okay. What else would you like to change or improve?
The oiliness
Okay.
of my skin. And then I do get cystic acne here and there. And I break out on my chin a lot too, I noticed.
So when you say cystic acne, do you get it on your chin as well as the rest of your face?
No, it's more so in these areas here.
Okay.
Yeah.
And what type of breakout do you get on your chin?
Just small pimples, not too,
Okay.
but I get a lot of them.
Kind of pustules?
Yeah.
Okay.
And I have a lot of blackheads, I've noticed too, on my nose.
And what else would you like to change or improve?
I think that's about it. I do have a little bit of wrinkles that I've noticed, and I'm only 25 years old,
Okay.
so that kind of bothers me a little bit. But I noticed that I do have a little bit of wrinkles underneath my eyes. But yeah.
And you mentioned to me, this was off camera, but you mentioned to me something about dark circles?
Yes,
Okay.
underneath my eyes, yeah.
Okay. And so this may seem kind of redundant, but how would you categorize your skin? Normal, combination, oily?
Oily, definitely.
Okay. And do you feel like it's oily everywhere on your entire face?
Not so much. I would probably say the T-zones for sure. But definitely my nose and my forehead.
Okay. And the rest of the face, does your cheek area ever feel normal? Does it ever feel tight and dry at all?
Never tight and dry. It feels normal.
Okay.
Yeah.
But does the cheek area get shiny?
Yes.
It does.
A little bit, yeah.
So you do kind of consider your whole face to be oily.
Yeah.
But you really get shiny in the T-zone. And do you feel like you have to blot, or you look in the, okay. Okay. Have you ever been a smoker?
No.
Okay. And you mentioned something about tanning in the tanning bed.
Yes.
Okay, so you do tanning beds about once a week?
Roughly. Once or twice, yes.
Okay. And what about just general sunbathing? Were you ever a sunbather?
I was when I was younger, yeah. But not so much anymore since I've been tanning in the beds lately. But, yeah, I do sometimes go out in the pool and I don't wear sunscreen. But that's because I don't burn. So I feel like I don't need it, but I know that, it's good for the skin and keeps it healthy.
Okay. So I could wait for that one for later, but I'm going to just mention that right now. So most of the damage you're going to see in your lifetime, whether it is, wow, my pores are starting to get larger, the texture of my skin is starting to look grainy, I've got fine lines, I have discoloration, and I don't mean just that discoloration from acne, but you start getting brown spots, all the things that you look in the mirror and think, oh, well, everybody gets old, it's going to happen someday. 90 to 95% of that was programmed into your skin before the age of 10 from sun exposure. And at least 50% by the age of 20. It takes 10, 20, 30 years to show up. So many times people will say, oh, well, gee, I really feel like my skin didn't age that much when I was in my 20s. And then all of a sudden at 35, it was like somebody let the air out of my face. It was like all of a sudden I started seeing fine lines, my pores look larger, etc. Well, that's sun exposure. And sun exposure, and tanning beds in particular, are even more intense. They will make acne worse. They will not make it better. Now, you may think the sun makes your acne better because what it does is it dries out the outer layer of the skin, causes it to harden. And what that does is that suppresses oil to some extent, and it suppresses some of the retentive material from coming to the surface. But that retentive material just builds up and builds up. So when a person isn't sunbathing or they're not doing tanning beds and the stratum corneum softens as it should, it normalizes, then all of a sudden you've got this terrible breakout. And people think, oh, it must be because I need to go back out in the sun. And it also is an inflammatory. Sun is inflammatory, and acne is an inflammatory process. So it worsens it all the way around, and it will worsen the discoloration. So when you have an acne lesion, it's an inflammatory process. And what happens is it gives off iron oxides as it makes its way to the surface. The blood gives off iron oxides, which is what gives blood its color. And so oftentimes you're left with reddish or purplish brownish. So the more pigment you have in your skin, the more it's going to be a kind of like a purplish or brownish look. And the area of that area is also compromised when you have an acne lesion. So when you go into a tanning bed, what happens is that your body pigments it even more because it says, oh, we have to protect it. So it makes it worse and worse. Now we can get rid of that, but it can take a long time. And when you tan, it's going to take longer and longer, and it will get worse over time. So we're to the point where it can be permanent. It'll never go away. So just some things to keep in mind. We'll talk more about that. So did you have acne as a teenager?
I did.
Okay.
It wasn't as bad. I had it a lot on my forehead, actually. And then I wasn't using anything. It just happened to kind of go away on its own. And like I said, the scars are from when I was younger. I had a lot of pimples on my cheek area.
So it went away on your forehead, and then when did it come back?
I'd probably say recently, about like a year ago, I noticed that my forehead was starting to break out more than it usually does. And I was trying to think of things that I've been using differently, but...
Well, as far as like the general acne, cheeks and everything, it's about a year ago too?
Yeah.
Chin and everything about a year ago?
Mm-hmm.
Okay. And nothing that you can think of that may have preempted that, like did you change birth control pills? Did you do any...
I've been on the same birth control pill for 3 years now.
Mm-hmm.
So I don't think it was that. And it's a very like low dosage, so I don't know.
Mm-hmm. Well, here's the thing about birth control pills. 1/3 of the time, this is statistics, and this is the one that's actually been approved. It's orthotricycline, I think. Hopefully I didn't get the brand wrong, but at any rate, it's the only one that's actually been officially approved for acne. Now, that doesn't mean that there aren't other birth control pills that have exactly the same percentages, but they went through the FDA to get that approval. What the statistics show is that 1/3 of the time they can make acne better, 1/3 of the time acne will stay the same, and 1/3 of the time it makes it worse. And it's not always necessarily right at the beginning. Generally, if you've been on it for a while, we can assume that it's probably not the pill, but not necessarily.
Mm-hmm.
And it's orthotricycline, I think that's the one I'm trying to think of. And do you know what brand you're on?
It's called Chatil.
Okay.
Yeah.
Not familiar with that one, but just so you know, there are 2 types of birth control pills. One is called Yaz and one is called Yasmin that actually do have a really good statistical improvement for acne. And it's because it has a derivative of something called spironolactone. But anyway, we can talk more about that. Okay, so tell me, what do you use? What do you wash with in the morning?
Right now, I'm currently using just a cleanser. It's Cetaphil, just because my skin is so sensitive and I have eczema, so I don't want to use anything to...
Cetaphil is actually a good cleanser.
Yeah.
Now, so when you say your skin is sensitive, tell me what you mean by that.
It just depends. Like when I was using the Murad products, my skin, I don't know if I was using it incorrectly, but my skin burned off. And so it burned off right here when I was using it.
When you say burned off, you mean that it got really red and
it like peeled off basically.
Okay.
Yeah. So I'm kind of more afraid to use anything else.
Mm-hmm.
And I do happen to notice that I do break out if I use something new.
Mm-hmm.
But I do use like a Vino moisturizer after I wash my face, and I notice that that has been okay so far.
Okay. So a lot of times when people break out when they use something, they think their skin is sensitive. And it's really not that it's necessarily sensitive, it's that you have acne. And some ingredients can actually make acne worse. Some ingredients can make acne better. So it's likely something that you're using is causing you to break out. Now, with regard to what you said happened with whatever was in the Murad product, I know that Murad uses quite a bit of salicylic acid, which generally is pretty benign if you use it right. If you overuse it, then you can cause a greater wound to the surface of the skin. And it's not something that's going to hurt you. It just is that you can temporarily create enough irritation that you kind of have to heal from it. So what do you do after the moisturizer? Anything? Okay, no sunscreen. And what do you wash with at night? Same thing?
Yes.
Okay, and same moisturizer afterwards?
Yes.
Okay. And do you ever do any scrubs or any masks or anything like that?
I would sometimes use our European Wax Center's face exfoliating gel,
Okay.
but it's not so often that I use it. I would probably say like maybe once a week.
Do you notice it makes it worse or better?
It kind of just makes my skin soft,
Uh-huh.
but that's
Okay.
about it, yeah.
Okay. Any masks or anything else like that?
No, I don't use masks.
Okay. So have you seen a dermatologist for your acne?
I have.
And what did they say to you? What was the diagnosis? Obviously acne, but
Yeah, she just told me that I should go on doxycycline, and I asked her about Accutane, but she said that it wasn't really necessary for my skin type. So I was on doxycycline, but I only used it for like maybe like 2 or 3 weeks just because I noticed that when I step out into the sun, it makes my skin more sensitive. So I guess that was one of the side effects of that acne medicine. So I stopped using it, and she just told me to use Cetaphil, and that was it.
okay. So different dermatologists have different methodologies and different ideas. And generally, the most severe form of acne is when you produce cysts. So somebody could have a whole bunch of pustules all over their whole face, and that would not necessarily be considered as severe as somebody who is a cyst former, because cysts tend to scar. They're much deeper, much more inflammatory. And so generally, Accutane is reserved for people that have been through all of the common kinds of treatments, and it just didn't work, and they're still forming cysts. But a lot of times physicians also look at it a little differently. They look at it like, well, you know, do we want somebody to go through all of these kinds of modalities and risk having more scars when we know that they're a cyst former and that's very difficult to treat? And generally, you can go on antibiotics, and had you stayed on them for a period of time, it probably would have worked really well for you. But the problem is, you go off of them, it's back again, because the antibiotic just simply deals with P. acne bacteria, and there are better ways to do that. But there are a lot of physicians who probably would have considered Accutane for you. And Accutane, I'm a big believer in Accutane if it's used appropriately, because it puts people into remission. There's no cure for acne. And remission for some people can be a year, 2 years, it can be the rest of their life. But for many individuals, it's just life-changing. And there could be some other things kind of behind your acne that we'll talk about. But this is good for you to keep in mind, because if you do see a physician again, then you can always have this discussion, and it may be just that you need to see somebody that looks at it a little bit differently. Okay. So first let's talk about the acne itself, and I'm going to kind of talk about the acne process. And you may already know this. I don't know if anybody's ever gone through this, but I think it's really good to visualize what happens in acne. How, it progresses, what the pathology is, because then you can kind of understand why certain things work and certain things don't work. So when you touch the outside of your skin, you're touching the stratum corneum, which is a dead layer. And we shed about 500 million cells a day. They're microscopic, so you're not aware of it. And when you look at a follicle opening, it's actually the opening into a long hollow tube that's only about as big around as the diameter of a hair. And I'll bet you thought, because I did, it's got to be bigger than that. It's got to be some big cavern in there. But it's just a very narrow little, almost thread-like tube. And at the bottom of that is your sebaceous glands that produce the oil. But inside of that little tube, so to speak, you have cells that line the tube, and they shed constantly. They fall off. And one of the reasons we produce oil is not to keep your skin younger, but it pushes the cells to the surface. They sit there and they fall off. That's the normal process. That's what's supposed to happen. Now, we don't know why. For some reason, in people that have a tendency to acne, and by the way, did you ever have brothers or sisters or mom or dad that had acne?
Yes. Well, yes. Okay. My mom.
Because acne, we believe there's a hereditary tendency. It's not been proven, but I mean, you can, goodness, look around you, and if mom or dad had acne, there's a good chance that somebody in the family is going to have it, but it can skip a generation, or you can be the only person with it or the only person without it. But at any rate, the beginning of the acne process is where these cells stick together and they form what's known as a microcomedone. Now, at that point, your skin could be perfect. You could have been forming microcomedones as early as 8 or 9 years old, because that's the average age at which women develop hips in the U.S., begin to develop hips. And the onset of puberty is not menstruation, it's breast development. So when you see a little 10-year-old, and if they're starting to develop breasts, they're in puberty. And they can be developing these microcomedones, but not have anything that really shows up on the surface of the skin. Now, you may not remember this, but if you thought back to when you were 10 or 11, and if you looked really close at your skin, if you ever saw any tiny little even grainy bumps, that's the beginning of the process too, that starts to show on the surface. So these microcomedones can be dormant, or for days, months, weeks. Lots of times when you get a breakout, it's not because of what you did yesterday or the day before. It's something that was brewing for a while. But they can also develop very rapidly. And the way that they develop is in kind of several different ways. So one is the most non-aggressive form of acne. The most benign form of acne is where the follicle collects these cells, and it needs more room, and it dilates, and you see an open comedone or a blackhead, clogged pore. Now, where it gets a lot more complex and a lot more inflammatory is that when the pore doesn't dilate, when it's kind of closed off, so to speak, the cells continue to stick together. It traps oil in the follicle, and it also traps P. acne bacteria. Now, P. acne bacteria is harmless. We have it. Everybody watching this has it. I have it. You have it. You can have really clear skin and still have a lot of P. acne bacteria. But when it's trapped in the follicle and there's less oxygen, it loves that type of an environment, and it eats the oil, it feeds on it. And it releases an inflammatory fatty acid byproduct that wears down your follicle walls. Now, if everything stayed in your follicle, you'd never break out, and you might have clogged pores and blackheads, but you would never break out. But when that follicle gets to the point where it's so weak that it either leaks or it ruptures or it almost explodes, then you get a lesion. So if you have a leak at the top of the follicle, you're going to get a papule. It's going to turn into a pustule probably. Okay, that's a lesser form of acne. If you get a rupture more in the middle of the follicle, you're going to have a nodule or a mini cyst. So the nodules are those really hard ones under the skin. And it may be that you're getting nodules and not huge, giant cysts. But they're like I said, they're referred to as mini cysts also. And they may or may not scar. Now, usually they're going to leave behind discoloration, because what happens is as the inflammation makes its way to the surface, it causes a lot of inflammation, which discoloration. But also, in some cases, depending on your skin type, it can kind of wreak havoc with collagen. The ones that generally, that always scar, when you get a big cyst. A cyst, literally, it looks like the side of your follicle blew up. and the inflammation affects the dermis. So it kind of destroys parts of the dermis, and as it makes its way to the surface and destroys collagen and elastin, you end up with an actual scar, like a depression. So that's why cysts virtually always scar, and that's one of the reasons why if a person given a choice said, well, gee, I'm going to have a whole face full of scars, and some people have horrific scars from acne, or I can go on Accutane and not have that occur. So in order to treat acne, what you need to do is you've got to introduce something in the follicle, number one, that keeps the cells from sticking together. Doesn't matter how much you wash your skin, doesn't matter what the greatest cleanser is, and Cetaphil is a good cleanser. It's very gentle, but it can't get into the follicle. I'll tell you what can. And the other thing that you have to do is you have to introduce something in the follicle that also deals with P. acne bacteria. Now, you can't kill P. acne bacteria permanently, so it's not bactericidal, but it's bacteriostatic, meaning that you need to keep the colonies down to the point where they're not getting large enough to create your follicles to rupture. And if you can do that, you have complete clearing. And then we also we want to use anti-inflammatories, and we want to use things that deal with the superficial aspects of acne, which would be discoloration. It's large pores. It's wanting really even skin tone, wanting the skin to glow, and just feeling like that your skin, well, I don't know how to put it any other way, but it just looks really even and really healthy and glowing. Does that make sense? Mm-hmm. Okay. So so that's one thing. We need to kind of address that. Now, the other thing that you mentioned is you mention that your skin is oily. And part of that is genetic. Sometimes what happens is we see that when we treat the acne, that there is there's a lessening of oil to some extent, but also it's just distributed differently. What happens when you're not dealing with those dead cells and you're also not resurfacing the outside of the skin, which makes the skin look very healthy and glowing and even toned, is that your stratum corneum, which is that thicker dead layer, clings onto the oil. And so it also can make it look patchy and uneven, because you kind of feel like my skin doesn't feel really smooth, but it's got all this oil, and it literally will absorb it and cling onto it. Now, once we resurface that, it's not necessarily that you're producing less oil, but it looks more like a glow as opposed to an oil slick. It looks more like the skin is dewy as opposed to oily. And usually people can deal with dewy because you get compliments on dewy. Oily you feel kind of self-conscious about. Okay, so we'll have to kind of see where that settles in. Now, as far as the dark circles go, that is hereditary. And you inherit where your blood vessels are going to be. So people with dark circles tend to have blood vessels that are closer to the surface. They show through more. And what happens with sun exposure and tanning beds, and it gets worse. And one of the reasons it gets worse is because those blood vessels become compromised. And what affects that whole area, your sinuses are really large. And whenever you put pressure on those blood vessels, like say you have a cold, you don't get enough sleep, you're under stress, I'm sure all these things, allergies, yeah. You notice that they look even worse. And it's because what happens is that the circulation slows down and those blood vessels engorge more with blood, and it's even more obvious. And it generally gets worse as time goes on because as you age, the vessels are more compromised. Now, we actually can address some of that. We really can. I used to say, people would say to me, so what can I do for dark circles? And I had a really sarcastic answer. I'd say, pick your parents. But there are some things that we can do. And some of that also can be actual discoloration in the eye area. They found that doing peels underneath the eye area oftentimes removes some of that superficial pigment. So it's a combination of pigment, it's a combination of a number of factors, but I think we can definitely, I believe, improve on the appearance of that. Is there anything that I missed on that?
No, I don't think so.
Okay, so the thing that I also want to go back to on the acne, just for you to keep in mind, what you said about how your acne has progressed is really common. So many times there are people that have acne as a teenager and it kind of subsides, it just goes away. And then all of a sudden when they're 25, 24, 30, 35, it's back again. And maybe as teenagers they had it more on the forehead or they had some on the cheeks. And now it's not necessarily on the forehead, it's on the chin area. It's the chin and perioral area. And most physicians feel that much of the time this has to do with this testosterone sensitivity. So you have enzymes in your follicle that are harmless, and you have them up here in your hair as well. And then outside of your follicle, you have hormones, which is normal. You have estrogen, progesterone, and testosterone. And your testosterone, we have almost as much as women, we have almost as much as men have, except ours is bound by proteins, which means we don't get a deep voice and we don't get a hairy face and a hairy chest. But if you have a little bit of a testosterone sensitivity or free testosterone, it's not going to show up in a blood test. The range of normal is very wide. It gets together with the enzymes in the follicle and produces dihydrotestosterone. And it means literally instant acne in this area. And it's really, really hard to treat. Sometimes it even fails Accutane. It'll go away, but it'll come back. Because what you have to do is you have to keep those two from getting together. Now the way that it's blocked, and again this is something at some point, if we don't get you really clear, you can talk to your doctor about. And you know how they block it? It's done today with a prescription diuretic known as spironolactone. And all spironolactone does is it kind of puts a wall up between those two that keeps them from getting together. And it also cuts oil anywhere from about 60 to 80%. It doesn't make you dry, it just normalizes everything. Because having that testosterone sensitivity can also increase the oil dramatically. And a lot of women will say, well, I was kind of oily as a teenager, but I'm oilier now that I'm in my 20s or my 30s. So it can make a huge difference, and it's called low-dose spironolactone. I can write this down for you afterwards, but by the way, it's spelled S as in Sam, P as in Peter, IROLACTONE. And instead of taking it, it's usually given for like congestive heart failure and high blood pressure, instead of taking the big high doses, you take very low dose, like 50 to 150 milligrams a day. And it's so much better and works so much better than long-term antibiotics. And lots of times antibiotics don't even work for this kind of situation. Okay, so just something that you can keep in mind, and we can talk more about that. So what are we going to do today? Well, first of all, I'm going to kind of piecemeal the system that I'm putting you on. Normally I put people on our basic skincare management system, and then I would add to that the things that you specifically need for acne. But she's using very little now. She's quite oily. And so what I'm going to do is I'm going to recommend our bioglycolic facial cleanser. It's basically the same consistency as Cetaphil. But the difference is that it has glycolic acid in it. Now you can have the best cleanser, and I make cleansers without glycolic acid, but no cleanser can get into the follicle. The molecule's too big, but glycolic acid is a tiny molecule, and what it does is it goes into the follicle, and its job, whether it's the outside of your skin or the end of the follicle, is it dissolves and dislodges the glue-like substance or cellular cement between cells, and it causes them to lift apart. It keeps the cells from sticking together, interrupts the acne process, helps to interrupt it. And on the outside of the skin, it does the same thing with that dead layer, but it's not about a scrub, because scrubs can be inflammatory. They can actually create microscopic tears in the skin and worsen your inflammation. So what it does is that it can really, again, resurface the skin and deal with superficial imperfections. The appearance of the scars, the appearance of discoloration, the acne, all of that, and just make your skin look so much more even and glowing. So we're going to do the bioglycolic facial cleanser. And then I'm going to recommend for you, I'm thinking. Okay, that's why this is dead space. You shouldn't have dead space, but I'm thinking. I think what I'm going to recommend for you is our transformation serum. So this is very light. And then the thing that's going to be really the cornerstone of your program is going to be so important. Well, I'm sorry, I missed one step. I'm going to recommend BioClear lotion. And BioClear is a combination of glycolic, salicylic, and azelaic acid. It is an incredible resurfacing agent. So even if somebody just had fine lines and they just wanted their skin to look so much smoother and their pores look smaller, I would recommend it. But for you, salicylic acid gets into the follicle. It helps to go after the original comedone. Glycolic helps to keep the cells from sticking together. Azelaic acid is sold by prescription for rosacea, sold by prescription for acne. It's one of the best resurfacing agents we've ever seen. It also brightens the skin. So that's going to be really key for you. And the other one that's going to be really key is the duality. This is going to be like the big guns. So duality is 2 gold standard topicals that are used for acne. One is benzoyl peroxide. Most people, when they hear benzoyl peroxide, they go nuts because they go, oh my God, it's a teenage medication, it's going to dry my skin. Maybe you've used it before, I don't know. Have you ever used benzoyl peroxide?
No, but I've heard of it.
Okay.
Yeah.
Well, the way that it works is benzoyl forces peroxide in the follicle, it releases oxygen. P. acne bacteria can't live in oxygen. It kills it better than anything ever invented. And that's a statement by the American Academy of Dermatology. And if it works for you once, if it's the right percentage, if it works for you once, it'll work for you forever. You can't develop a resistance. Now, in terms of the drying part of it, this is a new, different benzoyl peroxide. It was actually tested in Alberta, Canada, in weather that was 20 degrees below zero by Dr. Jaggi Rao, who's board certified in the US and board certified in Canada, and he is the head of the dermatology residency program at University of Alberta, and he is the CEO and founder of the Acne Clinics of Canada, so he teaches more acne than anybody else. The skin was more hydrated after the study than before. That's with benzoyl peroxide. And the results were superb. So it's an exceptional product. And generally, you're going to start to see clearing right away. And if you've not used benzoyl peroxide before, I think this is going to be a real eye-opener for you. Now, this is a dual chamber product. See, 2 buttons. And the reason is because in the other chamber is retinol. And retinol can also be fantastic for the appearance of acne. This is retin-A's cousin. When you put retinol on the skin, you have an enzyme in your skin that immediately converts it into retinoic acid, which is the active ingredient in retin-A. And if you put them in the same formula together where they sit there, they render each other inactive. So that's why we have something that's actually dual chambers. But that plays a huge role in helping with discoloration. That plays a huge role in helping with just the overall appearance of the acne. It can help with scarring because retinol is believed to encourage collagen, so the appearance of the scarring can lessen over time. There's one other thing, though, that we're going to want to do for your skin, and this is going to be future consideration because we need to get you clear. If you're not clear, the more acne you get, you end up with more discoloration, you end up with more scarring. So we want to kind of get you to a baseline of clarity. And then probably what I'll consider at some point is something called luminant, along with everything else. Finally, our SPF 33. Now, the SPF 33, it's a sunscreen. But one of the things that I absolutely love about the sunscreen, and one of the reasons it's a cult favorite, it has an unlimited capacity for oil absorption. And it cannot absorb your actives, and it can't absorb moisture or water out of the skin. But any place where you're oily, it really balances, and any place where you tend to be dry or normal, it's going to leave it really soft and soaky. When I'm indoors, I still wear this product. And until I was about 24 years old, I was an avid sunbather. From Southern California and San Diego.
Oh, yeah.
And I sunbathed whenever I had the chance, and I also started every summer with a good burn. So the thing about sunscreen is that they've done studies where if you start using it 5 years later, with nothing else, using nothing else, your skin will actually be younger than it was when you started using it, because your skin can actually do some repair. So that's important. And also because, you know, skin cancer, malignant melanoma, which is fatal 50% of the time, the risk of that is so high. Okay, so I'm also going to recommend for you something called Cleanzyme and Skinzyme. Those are proteolytic enzymes. This is something that you could do once a week, twice a week, or even more frequently once your skin kind of settles in. What they do is they digest dead and diseased tissue without hurting normal living tissue. It's like a mask. But it's not a scrub. Scrubs don't know what's dead and what's not dead. You just sit there and, you know, rub at your face. And this is intelligent. This can only go after dead or diseased tissue. And when you take it off, your skin looks like glass. I mean, it is one of my all-time favorite products. I can't, there's so many different things that I can't live without, but in terms of sort of the icing on the cake and giving that skin that just really glassy, poreless look, this is hands down a terrific product. So for the size of the follicles and just, you know, that look that you want, that everybody wants, I think that's going to be a good one for you. And then finally, I'm also going to recommend the Luminant Eye Gel. That was specifically made for the appearance of dark circles, but it is really tremendous for also the appearance of the fine lines kind of underneath the eye area, and that kind of come in here and then they start to go down here, they kind of creep down. These lines here, that's known as dynamic muscle movement. That's Botox. These lines, if you get them, I'm not saying you have them, I don't see it, but forehead lines, parenthesis lines, that's Botox.
Oh yeah, I have the parenthesis lines.
Okay. So can soften that, but that's something that's different. And the other thing that I might recommend for future consideration would be our Hyla 3D. And any questions?
No.
Well, there you have it. So thank you so much for tuning in, and please subscribe. I'll see you later. Bye.